Hello, my name is Russell. I'm a medical student going into psychiatry, and today we will be talking about the relationship between Trazodone and Priapism. This is something that keeps a lot of men from trying this drug for insomnia. So I'm here to just tell you what I know about it. We'll look at some of the data and what to do if it happens. So just a little overview. Trazodone is an antidepressant that was released, I think, in the 80s, but it never really caught on because at antidepressant doses, it's so sedating. So when you take like a third to a sixth of what would be a therapeutic dose for mood or anxiety, you get great sleep instead. So one of the scariest side effects, but rare, but also dramatic, side effects of Trazodone is priapism. Priapism is an inappropriately long erection that is not relieved by ejaculation. So why does Trazodone cause priapism in a small amount of people? This is thought to be mediated through alpha adrenergic receptors and the blockade at these receptors that this drug does. So alpha adrenergic receptors, these help control the width and the relaxation or dilation of blood vessels, including in the penis. And if you get too much of a blockade here, this can, when you get an erection, it will trap the blood in your penis, and it can have devastating consequences. So priapism, if not treated properly, oftentimes goes away, but if it doesn't, and it's over 24 hours or so, this can be devastating. I've seen a case report of a penile amputation after Trazodone-induced priapism. This is, of course, very rare. This is just a case report. But it's scary. So let's get into this. So the official numbers on... So when you look at how common this is, I see anywhere from 1 in 1,000 to 1 in 10,000, which isn't super helpful. If you just go to the Wikipedia page for Trazodone, they cite a paper that says it happens in about 1 in 6,000 people. Regardless, this is a very rare side effect, but scary. So a couple things about priapism from Trazodone. This usually occurs in the first month or two of treatment. It's also been shown to occur at small doses, but this, I don't know, I'm not super convinced about that because, most people take low doses of Trazodone because it's for insomnia. So it could be that higher doses is even worse. I don't know. There's not enough data to really go into that. But it's usually doses of under 150 where this occurs. And so priapism, there's two different kinds. There's high flow and there's low flow priapism. High flow is usually from trauma. Low flow is the scary type that priapism causes. This is when blood gets trapped in the corpora cavernosa of your penis. And so what do you do if this occurs in your situation? So if you have an erection that lasts over 2 hours, I would personally go to the ER if that were happening to me. Some recommendations say if it's lasted over 4 hours. So there's a couple things that you can do, though. Some websites actually recommend that you take pseudoephedrine before going to the emergency room, like waiting an hour. And then if it hasn't cleared up, go in. So because Trazodone causes priapism through a blockade of alpha adrenergic receptors, it would make sense that drugs that actually activate or agonize alpha receptors might actually help. Pseudoephedrine, there's some evidence that probably helps. That's straight up just Sudafed, so that's not by prescription, but it is behind the counter now. It's not over the counter. You have to go and talk to a pharmacist since Sudafed is used in making meth nowadays. But let's say you've waited a couple hours, it's not getting better. What do medical professionals suggest that you do? So generally, the recommendation is to go to the nearest hospital. This is an emergency. The urologist on call will be called immediately, and they'll try various things to try to to cure your priapism. So one of the first things they'll do is probably, hold on, oops. One of the first things they'll probably do is give you either pseudoephedrine or another alpha agonist, phenylephrine. Sorry. Sometimes this is a shot. Sometimes what they'll do actually is they'll put a huge needle in your penis and aspirate or suck out all of the blood. Sometimes this is also used in conjunction with saline aspiration, which just means that they clean out your penis with sterile salt water. Sometimes they'll inject these alpha drugs directly into the penis if it's not an intramuscular shot. So let's say they've tried medications, they've tried sucking out the blood to relieve the pressure, and that doesn't work. The next step that usually happens is a shunt. The most common type of shunt for priapism is a winter shunt, and this is when a large biopsy needle is inserted through the glands, also the tip of the penis, into the corpora cavernosa to try to alleviate the blockade that way. So if that doesn't work, if a shunt doesn't work, they'll try whatever they can. If you've tried all of these things and it doesn't work yet, there is a chance that you will have permanent damage to your penis. If your penis doesn't get new blood for long enough, you'll get ischemia, which just means there's not enough blood. The tissue in your penis will start dying, and this can be devastating. This will cause fibrosis inside of your penis in the corpora cavernosa, and this can make it difficult or impossible to get an erection. So what would you do if that were to happen? The options then would be penile prosthesis. So there's two main types. You can either get a type of prosthesis where you can pump up your penis with like a pump type thing, sometimes located actually in your scrotum. And then sometimes it's this thing that is surgically placed around your penis that you can kind of just like I don't know how to describe this. It's like a little joint that locks into place that you can get kind of an erection for sex. So after saying all this, it's important to note that priapism from Trazodone is very rare. A large percentage of people that have priapism are able to be treated or it goes away. Most people don't end up having permanent penis damage, but it's something that a lot of people worry about. I've seen this in medical school all the time, where there's been various male patients that had heard about priapism for Trazodone, and they don't want to try it because of that, when it could have been an amazing drug for their sleep and could have helped their depression if they were able to sleep more. So this is information only. None of this is medical advice. I'm not advocating or not advocating the use of Trazodone. Talk to your doctor before starting any medications. If you have any comments, leave them below. Thank you.